Do periods change dates? This question is a mystery that has confounded women for centuries. The answer is no, periods do not change the dates of ovulation, though they may affect your cycle. Periods are generally thought to occur sometime during the middle of a woman's menstrual cycle when an egg is released from the ovaries. A woman releases one egg per month, which can only be fertilized by sperm for 12 to 24 hours after it leaves the ovaries. The days of menstruation can vary from person to person and between cycles for the same individual. Some women experience longer or shorter periods, with some cycles bleeding heavier than others, while other women have regular or predictable periods each time with little variation in duration or blood flow. Is it normal to get your period at different times every month? If you have irregular cycles, it is possible that you do not have the same amount of bleeding each month. Your cycle may just be very unpredictable or different for some reason, and you may not need to worry about getting your period at different times every month. However, if there are signs of abnormal bleeding in your cycle, such as mid-cycle cramping or a heavier flow than usual, even if it does not start to bleed until later in the month, then it may be more important for you to talk with a doctor or nurse about your symptoms, such as irregular bleeding. If you experience periods that change from week to week and month to a month every year, make an appointment with your doctor. What to do if periods are not coming? If periods have not come for 2 or 3 months, it is a good idea to check in with your doctor. They can ask you questions, review your medical history, and possibly do a pregnancy test. This is a quick way to determine the best course of action. If you think you could be pregnant, make an appointment with your doctor or nurse for an ultrasound or blood test. However, it is unlikely that you are pregnant if you have not had your period for 3 months. When should I start using birth control? You can start taking birth control pills starting the 2nd day after the onset of menstruation, the 1st day of bleeding, up until the beginning of your next period, the onset of withdrawal bleeding. You may not know for certain when your period will occur, and you usually should not have intercourse until you talk to the doctor. There are some birth control methods that would be unlikely to protect you from pregnancy during this time, such as condoms with spermicidal ointment or the sponge. You should also not use vaginal deodorants, douches, or other vaginal products while using birth control pills. When are my most fertile days? The best time in your menstrual cycle for conception to occur is when ovulation occurs, around 14 days before the 1st day of your period. Women with very regular periods and predictable ovulation can often predict when they will release an egg. Found this video helpful? Like, hit the bell icon and subscribe. See you next time.